So my name is Adelina Vega. I'm the community health worker, and my responsibility is to find the most needy people, especially the elders, females. Um, this is from I prioritize what are their needs. Right now, after the COVID-19, most of their needs is food, believe it or not, due to the fact that they're afraid to go out. They send out for deliveries, and it's costly. So they usually call me and says, Adeline, I cannot go. I'm afraid to go out because I don't want to get contagious. So what I'm doing, doing boxes of food, toiletries, whatever they need, and I will, deliver them at their house, with my safety guard and using all my protocols. And if they need medication, I will go to the pharmacy, obtain the medication from them, deliver it to them. Also, due to the fact that in a lot of occasions, we have clients in the, with third age, they have renal failure and renal end stage. So I usually wait for the taxi to arrive in the hospital. From there, I take care of them, and I make sure that they get the quality of care that they need, especially with the blood analysis that they need due to the fact they're high risk. And they feel comfortable, at least they feel the support there. I also, right now, I've been working with two unique cases. The first one, I had a client who was shot in the face by her ex-husband, and she was a DV victim due to the fact that lead was still in her system. Now, after a long period of time, all this has come back. She had 8 operations, surgeries, and I've been, bringing her food, toiletries. She's in a lot of pain. She's also afraid to go out. PTSD, and now with this pandemic, it's worse. And those are the things that we do. We collect the information. We suspend the judgment, and then we decide what is the category of prioritization. If they need food, well, that's one of the most needy. And then we kind of like guide them through the mental health tool and the doctor, primary care doctor. The first thing I do, they're speaking Spanish, they don't understand the language. Language is a barrier. I call Jeannie, we do a conference call. We kind of like work things out. If she needs to call her primary care doctor, I will stay on the phone until we get someone on the phone, and then we make sure that this intervention gets accomplished. And it's so sad because when the client calls by themselves, they don't get no answer, or they have to wait 3 hours. But when there's somebody there advocating for them, they will call you back as ASAP. And that's my confrontations right now, that I have to, be involved, making sure that they get whatever they need. There's a lot of pain, like the arthritis. They're due to they're not being active as they used to. Well, body aches are start, coming, and I think also it's a psychology called the stress, the depression, because they were my older ladies were birds. They like to go out, they like to feed the birds, they like to go to with the other friends and get together. Now they're not doing that, so sometimes I think it's like, oh my God, this is coming more from mental health, and they need somebody to talk to. So I usually, the ones that are doing that, I usually call them like 3 times a week, but at the same time I need to prioritize who needs food. We've been going, like I have one lady who has stomach cancer. She had radiation, she had chemotherapy. She did not have any assistance. So what I did, I said, and on top of that, she had a 10-year-old that her daughter left her on her care. So I said, okay, so let's feed them first. And then I guide her at Mass Health, the food stamps, Social Security, SSDI benefits. I also educate her on the the laws of when you become 65, that they have to make sure they have to report 8 months first. And I also educate them on that. I'm also a Shine certified person, so I'm a little well knowledge on that. And I, you know, if they need Option Plus, if they need the Medigap insurance, I make sure that they get everything. If they need a walker, we work through. We pick up the walker, we take to the house. We kind of like we are the little errands person, but also we intervene on what they need. But we always have to prioritize what are their needs. Through all this that I've been working, I have done also a Section 12, because we have those cases that we have find them in the sidewalk, and I had to call the staff stayed with it. I called the Mass General. The Mass General came, you know, they were on the phone, they were waiting for her. She didn't want to go in the ambulance, and she had a knife in the bag. So we had to do all this intervention. To the end, the patient got in the hospital. I made sure. Then the psychiatrist called me back, and I said, okay, everything is all set. Those are the for faithful, like those are the things that we like to see, the outcome. That right now I have another lady that told me, Adeline, I'm in rehab. Thank you for your support. I'm looking towards getting better. I've been 5 months sober. And also another issue that I'm confronting is that a lot of these ladies, they have bad conduct in the past, and they're not aware of the wave of the 10 years is reducing the years to 7, and the 7 to be clear, the Corey, 7 to 5. So I also helping them with that, because in order for them to get housing, this intervention has to be done. So those are the little things that we do.
Thank you so much. You know, it's interesting. I think when we hear the words healthcare without walls, we think that it's really just medical attention. And what you have all just described is something that is much broader than that. And it's helpful for us to understand exactly how big a scope you all are trying to address with your organization. So the last question I have for you is, how can the community members of Old South Church become engaged and think broadly about what that might mean, from donations to gift cards to, I understand you have a need for office space. So if you could describe some of the ways that members could be involved in a service capacity, whatever, that would be wonderful to hear.
So I'm sorry, Adelina, did you want to say something?
I think also the gift cards can be good.
I was going to say that.
Because we are working with the elder. And then we need to not also give them the gift card, but who's going to do the shopping? So we do the shopping for them. In a lot of occasions, they due to the fact that they don't have, their health is so compromised that, I'll say, no, just give me the list and I'll do it for you. And that's what we've been doing in some of the times that we have the vouchers.
So that the gift cards are extremely important. I mean, I can tell you in the last month, we've spent over $6,000 alone on gift cards, for amongst our programs. The food insecurity during the pandemic is really, really serious. And even before the pandemic started, the administration had cutbacks food stamp benefits for people who were applying for food stamps. And it just doesn't stretch very far for people. So that's important. We also have, as I'm sure you're aware, we have a basket that we give women when they get housed. We have a welcome home basket that we give the women that includes practical household items, as well as a blanket that members of our church communities have made. We have crocheted blankets that they can put on the little bed that they finally get when they get housed. That's really nice. That's an important thing for them. We provide, in terms of the social determinants of health, we provide cab vouchers for the women to get to their medical appointments. And even though a lot of people have not been going in person to medical appointments, some of them are just impossible not to do. And so support for the cab vouchers would be very important as well. Some of the women need to have their have their medicines, their co-pays helped with their co-pays if they don't cover their medicines. As Adelina pointed out, we have women with chronic diseases that are on a lot of medications, and some of the newer medications have co-pays that are impossible. So the women end up dividing up their medicines and taking them every other day instead of every day. So help with medication support would be really important. In terms of the office space, we're outgrowing our space at Women's Lunch Place, and we've been asked to expand our services to the women at Rosie's Place. I think you know this. This is part of our request to the church. And so we're now looking for a office space in the sort of Back Bay area or in the downtown Boston area where we can put our Bridges to Elders team so they can be in a central location to see the women, to be able to go to Women's Lunch Place and see them, go to Rosie's Place and see them, have the women stop by to help fill out forms and so forth. Someone like Adelina comes along for once in a century, and she's just, the jewel in our crown, and we want to be able to have her be able to give her services to more women who deserve it. I'm sure that you can read between the lines that she's working about 8 days a week right now, helping the women and responding to every possible need that they have. So, and finally, the other thing that we need is support for our PPE. We have had to obviously invest in more masks, gowns, face shields, the Purell, the wipes, everything you can imagine. And we've been doing okay so far, but what's been happening is that the vendors now are raising their prices. And we're a small nonprofit. There's only so much that we have to put into this equipment. So that's important for us too. So donations that go towards the cab vouchers, the gift cards, the PPE, the welcome home baskets, all of those things are really important to us right now. And anybody who has office space in the Back Bay area that wants to support an absolutely outstanding nonprofit that helps women in the most personal and compassionate way, they should speak to me.
Thank you. This is all such wonderful information. The work that you do is so necessary, and I would say it's God's work.